name is Crystal Hankin, and I'm currently a physical therapy student at Campbell University. And today I'm going to be talking to you about medial longitudinal arch taping. So medial longitudinal arch taping is a temporary treatment for foot problems such as excessive or abnormal foot pronation. And along with decreased dorsiflexion, pes planus, and excessive foot pronation is a possible risk factor for plantar fasciitis. So flat foot is also a most common cause of posterior tibial tendon dysfunction, and prolonged pronation of the subtalar joint can cause increased problems up the chain, including patellofemoral pain and SI pain and low back pain. So taping can control foot pronation during static and dynamic activities such as walking and jogging. I'll be demonstrating the technique for the medial longitudinal arch taping. So first you want to start with your patient in prone, and you would like for their foot to be hanging off the table in a comfortable position. And the first thing that you want to do is you want to provide an anchor along the metatarsals. And you want this to not be too tight, but you want it to wrap around the entire dorsal part of the foot. Again, emphasizing that it's not too tight. The next part of this technique is performing teardrops. So you perform a teardrop on each side of the foot in an alternating fashion, and there's going to be a total of 6 teardrops. So the first one, you start along the lateral part of the foot, and you want to wrap all the way around the heel, and you want to go back to your initial starting point, making sure that there are no kinks, as those can cause some irritation to the skin. So now we are going to start with the teardrop along the medial part of the foot. So you want to start along the medial part of the foot, wrap around the heel, and come back to your starting point, making sure to remove any kinks that may have occurred during the transition. Now we're going to apply another lateral, and you want to make sure that while you're applying the teardrops that you're covering the entire bottom of the foot. So we're going to start a little bit more medial than we did on the last one. Again, wrapping around the heel. Making sure to remove any kinks. And coming back to your initial starting point. So now we'll apply our next medial teardrop, wrapping around the heel. And this one is our last lateral teardrop. And you can press down along the tape. And now this is our last and final teardrop. So medial part of the foot, wrap around the heel. And that concludes the teardrop portion. The next section of this medial longitudinal arch taping is you're going to apply the tape on the bottom of the foot. And you want to make sure that you measure out the distance that you need in order to cover the entire surface of the foot in a horizontal fashion. And you're going to apply a force in the center of the foot in order to stimulate weight bearing, and you're going to pull up in a medial direction. So you're going to perform this along the entire underside of the foot. So I'm going to apply a medial force again. after I tear this and measure out the distance that I need, so medial force, and then pull up. So the patient during this phase should state that they feel their foot being a little more supported along the arch. So that's center pressure, and then I pull up. So center pressure up. And also you want to make sure to remove any kinks during this phase, as that can cause some skin irritation. So now that I've completed that phase of the medial longitudinal arch taping, the next phase is providing anchors along the lateral and medial surfaces of the foot. So this just helps to provide a little bit more support to these loose edges that may come loose during weight-bearing activities or dynamic running activities. And provide that as a little anchor. And the last stage of this is providing another anchor along the metatarsals in order to, again, prevent any of those loose ends from coming up. And that is the conclusion of the medial longitudinal arch taping technique. Now that I finished the taping of the medial longitudinal arch, you can see that the entire bottom of the foot is covered and there are very few kinks. So now I would ask my patient to get up and walk in order to assess the current comfort level and to see if any adjustments need to be made.